Hello. Just waiting to get up around 100 or so, and we'll go ahead and get started in the interest of time. Okay, so I just want to start out with a little bit of just a status update. Of course, you see the numbers being updated, Monday through Friday on the website and on Facebook. We will be at 281 cases later today when we update numbers. So that's 8 more from yesterday. 54 active cases today. We've been staying around 50-ish. 18 of those are DOC, and we've been putting that in the post every day as well. Just a couple of things that we also look at, some data that is rolling averages. And so our rolling average is increasing. Of course, we saw a big increase when we saw all the DOC cases come in. But now the DOC cases are trickling in, not so much of this steep increase just because DOC. But we do have a lot of community cases right now as well. Seeing a 10% positivity rate. I checked that today, so that's over the last month, and that's based on the data that we have from the state. We are not required to receive negatives, but the state has submitted a waiver way back in the early days of COVID-19 and pandemic response for doctors' offices, labs, hospitals to submit negatives to the state health department, and so they are forwarding those on to us. The state health department is very overwhelmed right now, so I think there's probably going to be some delays, and we've heard a lot about backlogging of cases and that sort of thing, and so they're being very overwhelmed because Missouri continues to hit their one-day high several times this month and have now been placed on a federal hotspot list. So obviously, the big increases that we're seeing, you can go to the Missouri website, Missouri Department of Health's website, and look at the COVID dashboard, and you can see the top 10 counties on there for testing positivity rates. And thankfully, St. Francis County is not on there. However, I was looking at one of our CDC reports, and we are listed as a county with high incidence because of the number of cases that have been reported over the last 2 weeks. So that's important to know. Hospital capacity is good. Of course, you may have read the interview with Dr. Kirkley and myself from last week in local media. We do media calls every Friday with local media. That way we can get information out in print media and on the radio and try to reach all of the populations. And Dr. Kirkley, the medical director of Parkland, was nice enough to be on that call and is going to continue to be on that call to help us out and to talk about the hospital perspective. So right now the hospital capacity is good, but they are seeing an increase in hospitalizations. That doesn't mean that that's necessarily always St. Francis County people, but again, they serve St. Francis County and the region, and so it's important to know what that hospital capacity is like. I think I've suggested this before, but you may consider following the St. Louis Pandemic Task Force to look at the hospital data for St. Louis. Because again, a lot of our folks seek care there. So again, right now, hospital capacity, they're doing okay, but we are starting to see an increase in COVID-19 patients being admitted to the hospital. And including locally. So rolling averages are increasing. We're getting somewhere between 6 to 10 a day on average, which doesn't seem like a lot. But when we get cases or days when we get 20 cases in a day, and that's happened, 14 cases in a day, it is a lot. And these cases take a long time to interview and do the contact tracing. And we had a case that had almost 100 contacts. And so these things are very time consuming. And so we're doing the best that we can with the capacity that we have. I just want to say a couple just kind of special words, I guess. I know that you see me on here. However, that's because I am the public facing piece of this. However, we have several people in this office that are working to do pandemic response. Our nurses are trying to get ready for back to school and give immunizations that are required for back to school, which this is usually a very busy time of year for us. We give about a quarter of our shots in the month of August. And then we're also responding to a pandemic, and it is mandated for us to do disease investigation and contact tracing. So we are very much at max capacity right now. And I would just ask that, when the nurses call, the contact tracers call, we're doing our jobs, and please be patient with them and treat them with respect. I think we want to treat others as we would want to be treated, and it's getting increasingly more difficult to do these investigations because people are not wanting to be cooperative. And again, our goal is to prevent transmission in the community and protect people and prevent people from getting sick. Again, we're in mitigation, so we know we can't prevent all cases, but doing contact tracing and investigation will help us identify cases and identify sick contacts and put them in quarantine so that they are not in the community spreading disease. So again, I would just ask that people are kind to them. We've talked about this many times. I feel like a broken record a little bit, but the best things that we can do have already really been laid out at this time, and that is social distancing, wearing masks in public places where we can't social distance or keep that 6 feet distance, especially indoors. Hand washing, good hygienic practices, disinfecting surfaces, and then staying home when we're sick. So these things haven't changed, but we are seeing an increase in cases, and I think we really need to work to take these seriously and work together as a community to try to prevent as much as we can the spread of disease in the community. And so I know there's lots of controversy out there about masks, and it's a very, very much a politicized aspect of the pandemic. But again, I just want to express that the health center is a nonpartisan entity. And so our interest is not political. It is in the interest of the community and keeping people safe and well. And again, we need to remember that this is a major societal change for us in the United States. It's a huge cultural change. And, again, as much as we are encouraging masks where people cannot social distance, we want to remember that we need to give grace and encouraging people rather than shaming people, because I really don't think that is going to help us in getting people comfortable with wearing masks. And so again, we are encouraging everyone to do that, but help us and try to give grace where you can, and treat others as we want to be treated. So I did want to mention that going forward, nursing services on Thursdays will be closed until further notice. We need that day to be able to investigate cases and contact trace and get caught up on that piece. We only have 6 nurses in the building, one of which is me, and then another person who is federally funded that is for HIV case management. And so these nurses all have their own programs that they normally run. And then we also do our nursing services, still very busy with getting back to school shots and that sort of thing. And so we need that day to be able to, again, make sure that we're getting those cases really quickly and investigating as fast as we can. So I think that's all I have as far as that. I'm going to try to go back through and hit some questions. I don't see just a ton. So what percentage of people are asymptomatic? So I don't have an exact percentage to tell you. I could. We can look that up for you if you want, and go through our stat sheet. But what I can tell you, generally speaking, is that most people are symptomatic in the community. DOC cases, offender cases, are mostly, almost all, reported as being asymptomatic. But most of our community cases are symptomatic. We've only had a couple of people that have been asymptomatic cases in the community, and that's because they were a part of, sentinel testing somewhere, or they worked in another county where they had an outbreak in their workplace, and they just happen to be asymptomatic, but most people are. What percentage of infected people are hospitalized? So generally speaking, Again, I don't think we can make a lot of generalizations about our data set because it's very small data set. Generally speaking, about 20% of COVID-19 cases are going to be hospitalized. For us, since the beginning of the pandemic, we've had 15 people hospitalized, and over the last couple of weeks, 6 of that 15 have happened over the last couple of weeks. So just trying to answer some questions. Why are we not doing mitigation measures? The numbers are higher now than in March and April. The mitigation measures are those things that I've kind of been mentioning: social distancing, the guidance from CDC, masks, hygienic practices, and then staying home when you're sick. So, mitigation is really where we're trying to slow the spread of disease. There's no possible way for us to take the risk to zero. So I hope I'm understanding that question correctly. And so, contact tracing, investigations, those are a part of that, although in other times, that's not typically a mitigation effort. That's more of a prevention effort for that. But as of now, we are still being directed to investigate and do contact tracing. So, do you think it's safe to send kids back to school? So I get this question. I've gotten this question several times. However, I think the word safe is a tough word to use. I think, again, we're in mitigation. And so, I think it would be doing a disservice to say that there's not going to be any cases in schools. And so in my mind, that would be the safe measures that we could say, yeah, there's probably not going to be cases. But I do think we will have cases because we have cases in the community. They're increasing. We will have a case in a school where it's going to happen, or cases in schools. And so, that's why the schools are putting a lot of time and effort into creating their plans, again, in the essence of mitigation and understanding that they're going to have cases and what does that response look like, and then the contact tracing piece inside the schools. And then, when is it appropriate to close? And CDC, DESE, DHSS, there's lots of guidance around this. And, there's not always a cut and clear answer, but it's guidance to help them create their plans. And so I think, personally, again, this is kind of me just speaking as a person, everyone is going to have to assess their risk. So it might look a little bit different for a family who has, no risk factors, nobody's immunocompromised, you're not around people who are maybe in that risk factor category. But it may also look a little bit different for somebody who is in that risk factor category. So I think there's a lot of things to consider. I will post, actually CDC has a good tool for, thinking about that from a parent standpoint. And I'll post that when we post this video so that you can see that as well. Why no mandatory mitigation measures with the numbers rising? Isn't it better to be proactive than reactive? So I would agree it is better to be proactive than reactive, which is why we put out our statement last week on Friday about the rising numbers, because I think it's better to wave the flag again before and say, hey, we're seeing these increases. Let's work together and address this before we get to a point where that is becoming very concerning for hospital capacity, or we're seeing a lot of, high-risk folks being hospitalized, that type of thing. We can talk a lot about mandatory measures, but what I will say is that ordinances are created by the Board of Health, the county commissions, and the municipalities, or, we've seen broad policies, done from the state. There are statutory allowances for the closure of public places for the director of the Department of Health in a pandemic, but not for ordinances. I think there's, again, important things to understand here, or just think about, I guess. Generally speaking, the public support for, mandatory masking, and I'm just kind of using that as an example, is low, and specifically low in Missouri. And so we've all got to be somewhat on the same page and supportive of these measures to be able to implement them properly. And so the health center is going to continue to support and encourage people wearing masks in public places where social distancing is not possible. But at this time, there are no mandatory public health orders in relation to COVID-19. What is a safe quarantine period? I'm hoping I'm understanding this correct. So the quarantine period is 14 days past the last exposure. I may not be understanding the question correctly though. That is the quarantine period past the last exposure is 14 days. So again, that's not somebody who's sick. That's somebody who's been exposed to a confirmed case. Some of these questions I think I just answered. How many people have been tested in total? Oh, hold on, I can pull this up real quick. We're getting a lot of tests in. Normally I wouldn't just pull this up, but it's pretty easy to find the way we have it. So I will look and see. So about 5,400. Now that's not going to include everything because again, we're not required to get all the negatives, but I do think we are getting most of the community negatives from the state. But some of those, negatives from, all the DOC sentinel testing, all the SMMHC sentinel testing, we get what we get from the state. So, and they're not labeled as such. Those aren't mandatory like in March and April numbers are rising. Yeah, I think what maybe we're talking about here is like stay-at-home orders that were mandatory in early days of the pandemic when there was a lot of questions. We weren't sure how things were going to go, and we had the statewide orders. And since then, there's been a lot of reopening, and we do need to reopen the economy. But again, this really is a lot of personal responsibility, and unfortunately, we have to rely on folks to do that at this time. And so again, I want to encourage all of us to work together to exercise personal responsibility and understand that it's not so much about the me, it's about the we. And I would encourage people to follow those public health measures. Should schools be asking students and staff to wear masks as they open? Again, the health center's stance has been the same on that, and so that's our recommendation, is that people who cannot social distance, it's recommended to wear masks that are age appropriate. But again, the schools have their own plans, and they understand what is feasible in their district and what is not, and so that indecision is left to them. That's the public health recommendation, but that indecision is left to them. I'm just trying to get through here. I'm over on time, sorry. Do you know if the attendance guidelines for schools will be more flexible this year so the sick kids can stay home without worrying about going over a certain number of absences? So I haven't talked about this exactly specifically. They are aware of, and we've met with them. I was with them yesterday, the superintendents for our area. They do know the quarantine and isolation periods, and so I do expect for attendance guidelines to be more flexible this year. I don't foresee anyone getting, in trouble for going over a certain number of absences if you're placed in isolation or quarantine by the health center. I don't foresee that, and that's something that we can work on if that becomes a concern. Just trying to get through here. Trying. How effective are the rapid tests? I'm thinking we're talking about the antibody test, because that's the only type of rapid test that I know of that's being done locally. The antibody test isn't recommended for diagnostic use, so people who are sick really should not use that as a diagnostic tool. You should get a PCR test, which is a confirmatory test. So that's the recommendation. Currently, I think there will be a place for antibody tests, and there are in the way of public health surveillance. But, you know, again, it's not recommended. It's not recommended for diagnostic use. So, you know, and some of those, you know, you have to reach out to the manufacturer or take a look at the machine, because some of them will tell you they will detect antibodies for other coronaviruses. And so that's not exactly helpful at all. And so those are kind of the fine print that we need to think about when using a rapid test. But there are rapid tests out there for antigens. And so I don't know of any of those that are being done locally, but that's something as well. Will there be another free testing like the one at Mac? I know that the National Guard is no longer doing testing. The state had sent something out like that. And I know a lot of people have asked us for a report on that. I've requested that from the state, but they have not given it. And I think that's because they are very overwhelmed. They have told me they will do that, but they have not been able to supply that yet. So I don't know if all of the people who ended up attending North St. Francis County, less than 10 cases that we've received in the last couple weeks have been from that MAC event. But again, they didn't all have to be St. Francis County residents. You could be a Missouri resident and attend that. So, but just to answer your question, I would think no, it doesn't sound like it. However, you know, the health center does want to start testing eventually. However, we've got to get the personnel in place to do that. And we are hiring a public health nurse, and we will be hiring contact tracers. But right now we are very overwhelmed with investigations. So, you know, and I am going to ask for free testing in my CARES Act application, but that has to be approved. So I'd like to see that though. Oh, Great Minds. I know the one at Great Minds in Potosi was doing them. I didn't know about our Great Minds, but okay. So maybe that's do you know, I don't know if you know it's an antibody or an antigen test. We'll have to look into that. Okay, there's going to be 54, somebody asked about active cases. I know I said this at the beginning, but it's 54 active cases in the county today when we report out our cases. So I just kind of want to wrap up and say, you know, thank you for being on. We appreciate you all in the community and the things that you're doing to try to help protect your fellow citizens, your neighbors, your loved ones, that type of thing. And again, I would just ask that we all exercise, you know, grace and compassion and caring for others. And we try to move forward as a community in this, because that's how things are going to really turn around and help us to address the spread of diseases, for us to work together. And, you know, we want to prevent as many cases of this as possible, and you know, inevitably preventing deaths and preventing hospitalizations. And so we appreciate you all. And if you have questions, please reach out. You don't have to wait till the lives to ask. I know I say this every time, but if you have questions, you know, you can reach out to us via Facebook Messenger. We try to answer those twice a day. We try to monitor our social media, but we don't have a social media person that does this full time. Or you can give us a call. Again, we're busy, but if you leave us a message, we will get back to you and help to answer your questions. So again, I just want to remind everybody to, you know, try to social distance, keep 6 feet between you and other people. We encourage the use of masks where that's not possible, especially in indoor areas. And then good hygienic practices, washing our hands, age-old public health measure, and then staying home when you're sick. And again, you know, if you get the call from the health center, you know, for contact tracing or disease investigation, please know that we have one goal, and that is to protect the community and prevent the spread of disease. And so that's why we're giving you a call, and we need your help to do that. So we appreciate you. Thank you.